month of January, and so many of us made resolutions to eat healthier and become healthier this year. So we're here in the grocery store at Spartan Stores with Allison Reed, registered dietitian, to talk about vitamin D. And Allison, I know the most important way to get vitamin D is the sunshine.
Yes, but the problem is that during the winter time, especially in Michigan, we don't have a whole lot of that, right?
Right.
So that's why it may be important to go to other sources of vitamin D. You know, that's why we're here talking today.
Okay, we're here in the seafood case to start out, and I have to be honest, I never made the connection. Fish, vitamin D.
Yeah, actually the saltwater fish, the fatty fish are a good source of vitamin D. So for example, salmon is a good source. You can also find vitamin D in things like cod liver oil or liver, which, you know, maybe to some that sounds really appealing, but to others, not so much. So that's where you move into finding sources of vitamin D that are actually fortified into foods.
Why is it important that we have vitamin D in our bodies? What is the key piece of that?
Well, vitamin D is really, really integral in the body absorbing calcium and mineralizing the bones.
Okay. So is that why a lot of us connect calcium and vitamin D?
It absolutely is.
Okay.
That's really, really good. We've got a lot of different things here that are fortified with vitamin D that you actually see are natural sources of calcium. So they really work together hand in hand, and you'll see one where the other is usually. So we've got milk, yogurt, soy milk. People have a cow's milk allergy. The orange juice. So a lot of morning things, it seems, fortified into cereals as well.
Okay, eggs. I have to ask, is it special eggs or all eggs?
You know, all eggs are actually a good source, but then there are special eggs that have extra vitamin D fortified.
So you'll find that on the label?
Yes.
Okay.
You'll find that on the label.
The spreads too?
Yeah, the spreads. That's actually one of the other things that vitamin D is thought to be good for is heart health and, you know, keeping the heart healthy. So
fantastic. And I know February is Heart Healthy Month, so here we're going to make that nice transition.
We're moving into it pretty close. It's amazing how fast it's coming up.
Okay, now if we can't get it in our diet, what about some supplements?
So yeah, since the sunlight we don't have, the diet maybe, you know, you don't have supplements. You can find it in the liquid supplement here, which this would be like a balanced nutrition if you're doing, you know, a meal or snack on the go and you just really don't have, you know, the time to cook it or prepare. This is something that's really easy to grab and go. You'll find the supplements, again, calcium and vitamin D together. You can also find the vitamin D alone. They come in chewable or swallowable supplements as well.
Fantastic. Well, Allison, thank you so much. And of course, we can find all of these great products from fresh seafood to, of course, some of those other items, including the supplements, at our favorite Spartan Stores, D&W Fresh Markets, and Family Fare. Which is so great. I had no idea that salmon was so rich in vitamin D, which is one of those kind of great inside stories that you get to learn about.
Too.
Oh, well, now we know how to get vitamin D into our diets. We now want to know why it's so important.
And Chris Smith is the Pharmacy Services Manager for Spartan Stores. Chris, we're just going to pick your brain here.
Sure, no problem.
We were hearing a little bit about all of the foods and the importance. Really, it's important for a lot of people at different ages.
That's right. You know, vitamin D is really important. Number one in infants, and you know, as a parent, you know, I made sure that my child was getting the appropriate vitamin D supplementation. Check with your doctor first before you supplement for infants. But really, the most important population we talk about is our senior population. You know, vitamin D is so crucial to strong bone health. Goes hand in hand with calcium too on that, but you know, our seniors really need to be more aware of the vitamin D intake than anybody else.
And you know, I recently have started hearing a lot more about vitamin D, and is that because you're really trying to promote the importance of it, especially as it pertains to calcium?
It's a very interesting question you asked, Terry, just because there's been a lot of stuff out about vitamin D lately. There's been a lot of studies that are trying to look at vitamin D with cancer and look at vitamin D with diabetes. So there's a lot of buzz around vitamin D, but I think it's really important that you check with your physician on a lot of these things before you try to, you know, go out and buy all this vitamin D stuff. Just make sure that you're making informed decisions with the consent of your physician before you do anything, because really a lot of that research hasn't been played out yet. So
Okay.
stay tuned for more.
Fantastic.
So what is the recommended daily dose?
Sure.
You know, how do I know? Do I take one kind of, tablet or supplement or?
Right. Well, the National Institutes of Health recommends 600 international units a day. So
Okay.
on a label or on a package, it will say 600 IU. That's international units. So it's not like you're looking for grams or milligrams or pounds or anything like that, but the international units. So before you purchase anything at the store, make sure you're looking at that label to see how much is actually in there. And then it will tell you, if it's 300 IUs, you take 2. If it's 600 IUs, you take
Right.
1. So just make sure you're being a label reader.
And you can talk with the pharmacy experts
Absolutely.
within your stores too, because
That's
they're
right.
so helpful about.
Don't hesitate to ask. That's why a pharmacist is there. That's why your physicians are there. Don't hesitate to ask. Use them as a resource, if you have any questions at all about what you're doing.
So what about the possible implication of having a vitamin D deficient diet? If you are constantly, maybe month after month, year after year, not getting enough vitamin D, can something happen?
Right. Well, we all remember the old disease Rickets in children, and so that's a softening of the bones and some skeletal deformations in children if they're not getting enough. And then we all know about osteoporosis, and then osteomalacia, which is a brittleness of the bones that is more associated with the senior population. So that's why we encourage not only getting proper vitamin D from your dietary sources, but also supplementing, like Allison talked about earlier.
Yeah.
And so, is there some problems? Can you have too much vitamin D in your diet? What happens if you are exceeding the amount that you're supposed to have?
Sure, you can have too much vitamin D. That's why I kind of cautioned against with a lot of these things, just going out and throwing down vitamin D. Vitamins A, D, E, and K are stored in the fat if you get too much. And so they can build up over time and cause some problems. In women, that's, or men and women, so weight loss, anorexia, and it can lead to heart arrhythmias, which is a big, big concern.
And we by no means are saying take down the vitamin D to help you lose weight,
No,
because that would
no.
not be a good route.
No, it's really not. It might sound great, but by no means would we advocate loading up on vitamin D to save a little weight. If you want to do that, we all know what proper diet
Hit
and
the
exercise
gym,
is.
right, yeah.
and change the diet.
Right, yeah, too much of a
yeah,
good thing.
yeah.
Are there any possible interactions vitamin D may have with some medications?
Certainly, yeah, there are. So one of the main interactions with corticosteroids, drugs like Prednisone that are often used for allergic symptoms or asthma in some cases, over the counter, you can actually run into some complications with the drug Alli for weight loss, or if you're on the prescription strength of that Xenical, there can be some interactions there. And then for our people out there with epilepsy, the drugs Phenobarbital and Phenytoin can actually have some impact on vitamin D. So those are the interactions there. So if you're on any of those drugs or using those over-the-counter things, be sure to check with your doctor or pharmacist.
Right, and you know what? It's just a good starting point anyway.
Yep.
I know blood tests can screen for all those levels that you have. So great information. I know you guys have a super great section on the website that deals with
do.
all of the pharmacy issues. Plus, you got to get your yes card in there, right?
That's right. You got it.
Thank you, Chris.
Yeah,
We
thank you.
appreciate it.
It's nice to be here.
Stay with us. We have more 8 West to come.
This is 8 West.